Imagine you are out to eat with family or friends, and an individual begins choking and becomes unresponsive. They need CPR. This topic should be important because medical emergencies can happen at any moment. Learning how and when to perform CPR can save a life. Cardiopulmonary resuscitation, known as CPR, is an emergency procedure performed when someone's heart stops beating. To illustrate this, we will investigate determining if CPR is needed, the steps leading up to CPR, and performing CPR. So let's begin by determining if and when to begin CPR. CPR is a series of manual steps used to pump blood and oxygen to vital organs. Heart malfunction is the leading cause of death in the United States. With no author stated, in the National Center for Biotechnology Information in May of 2023, it says 70% of cardiac arrests that happen outside the hospital actually occur within the home. You have 10 seconds to determine the requirements for the need for CPR. These requirements include determining if the individual is unconscious, not breathing, or has no pulse. Now that we understand how to determine if CPR is needed, let's look for the beginning steps of CPR. Performing CPR requires a series of steps to be followed promptly and effectively to save a life. Checking your surroundings is the first step given with no author or date stated on the National American Red Cross site under What is CPR, which gives us a cardiac chain of survival with 6 links to help us achieve successful resuscitation. Calling for professional help is an important task because the time that it takes for rescuers to arrive is still very critical timing that should be used. Also mentioned on the National American Red Cross site, the chance of survival drops every minute without intervention and further risks for brain damage without enough blood or oxygen being supplied to the brain. Remembering CAB will help you know which steps to perform in which time. Now, let's begin performing effective CPR. Compression, airway, and breathing are 3 important steps in CPR. With no author stated, on the Mayo Clinic website under Cardiopulmonary Resuscitation, First Aid, on July 27th of 2023, it is stated that compressions are the most important step. To begin, you must place the individual on their back on a hard, flat surface. Place your palms on the center of the chest between the nipples. Keep your elbows straight in your position, shoulders directly above your hands. Press down 2 inches and use your body weight. Count 30 chest compressions. 100 to 120 compressions a minute is the outlined goal for effectiveness. It is beneficial to keep a person's airway open and clear to allow oxygen to enter the system. The head tilt and chin lift maneuver is used to achieve this. Place your palm on the patient's forehead and tilt the head back. Using your other hand, lift the chin forward to open the airway. Check for any visual obstructions. When someone is unable to breathe on their own, you must be their breath. Giving rescue breaths is an important step in supplying the brain and systems with oxygen. When performing with no medical devices, you must pinch the patient's nostrils close and cover their mouth with yours to create a seal. Give 2 rescue breaths. The first breath lasting 1 second and checking for chest to rise. If the chest rises, give the second breath. If it does not, adjust the head tilt, chin lift, and try again. Kay Holland on Healthline with no date publication states a healthy blood oxygen level is between 95 and 100%. If it falls below 80 to 85%, you will begin experiencing visual and cognitive changes. Return to chest compressions and begin the process again until help arrives or an AED device is found. Now you have the knowledge to perform the steps of a successful resuscitation for an adult. Cardiac resuscitation is an important task to learn and understand in case of an emergency cardiac episode. Today, we learned how to determine if CPR is needed, the steps up to performing CPR, and how to perform CPR. There is no difference between saving lives and extending lives because in both cases, we are giving people the chance of more life. Aubrey DeGray, biomedical gerontologist. Thank you.